morning, everyone. Please take your seats. Thanks very much. Is that mic working? Because it sort of was when I...
Yep, there you go.
I just got to get really close. Sorry. Okay. This morning you're going to hear from Kipp, who is a physical therapist. Dana Vollmer has been here, and many of you have heard her talk, and she's got a shoulder problem at the moment. Kipp is one of these people that walks into venues and, you know, if you look a bit crock, if you look a bit funny in your seat, he'll come up to you and say, "What's your problem here? What's wrong with your hip?"
Hopefully not that overt.
And he'll put it right. He told us some very great stories last night about his wild childhood, but this morning he's going to stick to the theme.
Yes, yeah.
And I asked him to describe, just in layman's terms, what he was going to talk to you about this morning. And he described it very well as, you know, do we need to floss our teeth? Answer, yes. It's as simple as that. There are all sorts of reasons and consequences if you don't. So I'll give you Kipp Dye. Thank you.
Yeah, good morning, everybody. Thanks for coming on out. Today we're going to talk about something very simple. How many of you as coaches implement massage therapy into your program? Let's see a sign of hands. Okay, so we've got 5% of the crowd. Well, I'm here today to tell you that after years of experience, not only as a PT, former competitive swimmer, but now as a product inventor, I've been doing that for quite some years as well. One day I was in the clinic and somebody was rolling on a, you know, typical smooth foam roller, and they're good. But I thought, well, hey, potato chips have ridges. Why don't foam rollers? And it seems like if we could get ridges on foam rollers, we might be able to do something actually a little more effective than what's been done. And this was back in 2007. So shortly thereafter, I filed a U.S. patent on this particular concept. Well, a number of years later, I was granted the patent, and now I've gotten kind of deeper into product development. And I'm one of these individuals that I'm very, I practice physical therapy all the time. I have a clinic in the Boston, Massachusetts area, and I'm not here first and foremost to say, well, my concept is the way to go, it's the end-all be-all. You're not going to hear that from me. What I'm saying, this concept of mine is demonstrative of maybe as you guys have come up with, or others, ideas where are going to continue to crop up in the marketplace that we can use in our particular realm of influence over our athletes, or even ourselves. And so the basis of my discussion today is talking about this whole concept of self-muscle connective tissue release, self-myofascial release for the competitive swimmer. That's what we're here at this conference for. We're here to help our swimmers, our subjects that we're trying to move forward into better competition. But then the bigger theme of this conference has been a better life, become a better person. And I can tell you this, after I went out for a walk yesterday, I went about 8-9 kilometers. I just turned 50 years old, and I realized, do I really need to keep rolling out on these things I've invented? You know, sometimes I have this debate, it's like flossing my teeth. I was like, maybe not. Well, all of a sudden I realized, I woke up this morning, I've got a knot in this hip, I've got a knot in this side of my back. So once I spent 5 minutes releasing those knots, my gait pattern was normalized. I felt much better. And my goal when I become 80, 85, I have the fortunate experience of living that long, I want normal gait pattern. And that would be upright, neutral spine, not, hunch forward, internally rotated with my arms, typical swimmer's posture, and we'll get into this. But I'm beyond swimming as an individual. I'm talking about wellness, being the best I can be in my day-to-day life. So what is self-myofascial release? Basically, in a practical sense, it's using different various fitness accessories to mobilize the fascial tissue. Basically muscle, tendons, things that are connecting all those structures together, ligaments. You have to be a little more careful when you're mobilizing a ligament. I can get into that on individual discussions if you have questions about that. If you have MCL pain, versus different ligaments of the body, there's not too many actually get at directly in the body. There's a not too, but in terms of the things that we can accomplish through SMR is decrease the tightness of the muscle tissue, increase your flexibility, increase power, optimize posture, improve recovery and warm up, and enhance daily living, kind of all the things I've been touching upon. And you might be thinking, as coaches, does this thing really do all that? And I can actually say, yeah, and I'm going to get into the research here in just a few minutes. And today's not going to be long and drawn out. Third day into the conference, it's early. I don't think you've had enough coffee, but we're going to make it really relevant. I want you guys walking away saying, that was thought-provoking. Maybe this just might help my athletes. So in terms of the benefits, I think in terms of an overview, I think they're actually empirically supportive, in the research, so it's effective. And they're proven to be a great health and wellness tool. They're utilized more and more in the medical clinical setting. Optimized posture, and I'll get more into this. They're convenient. Some of these rollers you can almost put in your back pocket. You can throw in your gym bag. You can take them on the plane with you. They're not very obtrusive. And you can utilize them anytime. This is the key. It's about our very hectic lifestyle. We're all sitting at a computer, sitting on the plane, sitting in the car. And time is really an issue. I should have underscored this. Time is really our most precious commodity. And we want to optimize that, being coaches and working with high-level athletes, even our age groupers. And also cost-effective. Really what we're talking about is this is a very inexpensive methodology versus massage therapy. I actually was trained as a massage therapist before I became a licensed physical therapist. So I think massage therapists are still very critical, and we refer out to massage therapists all the time as a clinic. And you can even make your own homemade roller. Sometimes if you ever talk to anyone who says, "Oh, I have a PVC pipe and I've glued on, or attached ridges of metal," or it almost sounds barbaric, evil. But those are valid tools for soft tissue mobilization. So really what it boils down to is this whole kind of enigmatic notion of what's fascia. What does this term mean? Fascia is really not tendon, it's not ligament, definitely not bone tissue. But what it is, seeing this picture here, it's painted, almost like it's like a paintbrush came through and just kind of coated everything with this connective tissue that surrounds muscle, bones, organs, nerves, blood vessels, other structures from head to toe. How many of us, we're all aging, that to the women in here, just the men, right? How many of you have, you've been lying on the couch watching your sports and you're in this kind of weird, concocted position, and then you get up, how do you feel? You feel like you're kind of winding your, all of a sudden you say, "Oh, I feel pretty good." Well, this is all the fascia that's connected. So in one way, if I pull on this side of my body, as Milt's been referencing, whatever you do kind of up here, it affects down there. Well, a good portion of that, but not all, is the connective tissue, the fascia. And I think a lot more awareness about this whole concept. And now this slide, I picked this out to show you guys. It was very, very difficult to find it in histology or under the scope. I wanted to get a histological kind of representation. It looked like in the muscle, as the muscle's knotted up in a trigger point. I won't get into all that right now, but basically just nodding. What does that look like? Well, little babies are born, and you can take microscope and look at their tissue, and in the muscle tissue be very parallel. The fibers would be very parallel. Unlike this, see, it's very wavy, very irregular. This is what happens with overtraining. And if we're not spending time in terms of what are we doing for ourselves and our athletes for optimal recovery. There's a well-known swimmer, Roland. I was talking to one of my colleagues back there who knows Roland. He's a high-level swimmer out of South Africa. He relies on tools like talking to you today to keep, even at an older age, a very, very successful swimmer. He takes the time. He sees the value in taking care of his body, as flossing our teeth is very critical in our overall health. Let's skip past this. It's pretty funny. This is kind of how I see swimmers as a clinician. Maybe not so hairy, but I do see swimmers very typically coming into the clinic, and this is most of our lives. Wouldn't that be fairly accurate to say? It is. Now, clinically speaking, you could put various human postures into, say, these 5 categories. Sway back, kind of resting on your ligaments, lumbar lordosis. You're walking around like, well, I won't get into that. Third one is you've got kind of a hunched back. There could be some medical reasons for this, but I'm just looking at posture. Here is more typically what we see forward. And then forget all these bad examples. This is what we're striving for here, is neutral spine, where the ear, shoulder, hip, knees, ankles are generally in vertical alignment. That is what probably the best definition of neutral spine, because the term is thrown around a lot. There's dynamic neutral, there's static neutral, but what we're really dealing with here is static. From a sagittal plane posture perspective, this is neutral. But typically what we do see in the clinic are these two right here. These are the two postures we see in swimmers most frequently. And it is concern. I'm not even saying minor concern, great concern. Because, well, what do we do about it? We in the clinic in the U.S. have limited time and resources with managed care to fix the kids coming in. Granted, we treat older folks that are master swimmers, but their problems are really quite different than the 12, 13, 14-year-olds we see. That's when the early kind of ages of when we see them literally flooding into our clinic for help. And you might be saying, well, what kind of help do they need? Well, a lot of it's postural based, but that really is the result or a symptom of what they've been doing or not doing in the pool. So self-myofascial release helps correct and prevent, because these are kind of dynamic things. These are not mutually exclusive. If you could put a circle here, this circle would kind of touch in and onto this circle of correcting and preventing. They're interrelated and they're very dynamic. But what we're doing here is trying to correct forward head, rounded shoulders, weak trunk, tight hip flexors, weak extensors. See, extensors are in the back of the body, flexors are in the front of the body. We're trying to correct non-neutral spine and posture leads to orthopedic, joint, myofascial, and neurological conditions. Self-myofascial release or massage therapy has to be in conjunction with strengthening and stretching. Okay, let's touch upon key things in our discussion here. Now, the joints will take care of themselves if we're primarily dealing with this myofascial issue. And if we're doing this, we don't really see the neurological problems presented in the clinical setting. The main neuro things we see, and do you guys ever deal with swimmers that say, I've got on my arm and I've got tingling into my hands? How many in the recent couple of years have experienced that scenario? 15%. A couple of years ago, I was speaking here about shoulder biomechanics, and one Swede, a gentleman, he says, well, we don't have any of those problems on our swim team. And I said, great issue, about coming in. Far more comprehensive or global, we're talking the whole body. So that's a hard one to get around, guys, no matter where you're from. But in this whole neurological, what's going on is this poor posture, and I'll get into some of the myofascial release techniques we can utilize, but I want to lay the basis for that stuff making sense. So you got your typical swimmer, it's coming in the clinic, and they're saying, my shoulder is really painful. And I go, where's it painful? Oh, here, here, here. I've got some nerve stuff, or burning and shooting pain, pins and needles down my arm. I said, that's a lot to